Before we talk about the election, I just want to ask you very quickly about COVID. In Scotland, the decision was taken to speed up the easing of lockdown. There are, though, these concerns about a new variant first identified in India. How concerned are you, and are you prepared to slow things down again if necessary?
Well, if necessary, of course, we have to do that, but I fervently hope it won't be necessary. We're making good progress here. Case numbers are falling. The vaccination rollout is going exceptionally well. But the big risk we face, not just in Scotland, but across the UK right now, is the importation of new variants of the virus, variants that might be faster spreading, that might be more severe, and crucially, variants that might undermine the efficacy of the vaccine. So we've got to be very careful about that, which is why I think one of the restrictions we're all going to have to live with for longer is a restriction on international travel. In Scotland, we insist that people quarantine in managed isolation wherever in the world they come to if they come directly into Scotland. And we continue to try to persuade the UK government to take a similar approach, because we mustn't allow the progress we're making domestically to be undermined by too lax a position on international travel. It's very difficult for the sector, and it's really important that governments support it as we try to continue to protect ourselves against the virus.
We spoke to George Eustace a bit earlier on the programme. He said that at the moment there doesn't seem to be evidence that the variant first found in India is more contagious or that it evades the vaccine. Is that your understanding as well?
So far, that would be my understanding. It is at the moment a variant of interest as opposed to a variant of concern. But I think the thing we've got to recognise about COVID is that it is mutating and we're seeing new variants appear in different parts of the world. The variant, of course, that has caused us in Scotland and other parts of the UK the most problem over the last few months is the Kent variant, the one that led us all into lockdown again over Christmas and into the early part of this year. So we don't know where the variants of real concern are going to come from, which is why an approach to international travel that tries to categorise risk, with some countries categorised as red list countries and other countries deemed to be safer, I think poses a risk, because none of us know right now where the next variant that might be really problematic is going to occur, which is why, unfortunately, and I take no pleasure in saying this because it's really difficult for the aviation sector, airports, tourism, we've got to be very careful as we continue to suppress things at home. We've got to be careful we don't allow it to be reseeded with more dangerous variants from elsewhere. I mean, if I look back to last summer, the later part of last summer, as we came out of the first lockdown, we almost eliminated the strains that were circulating within Scotland here, but we probably opened up international travel too quickly. So we allowed the virus to reseed into our domestic population. And I think it's important we try as hard as we can to avoid that in the weeks and months ahead.
The importance of learning the lessons from the previous year. I'm keen to talk now a bit about your domestic record ahead of the all-important elections coming up in May, and specifically just to start on education. So in 2015, before the last election, you said, "My priority as First Minister, and let me be clear, I want to be judged on this, is that every young person should have the same advantage that I had growing up." Now, research from Glasgow University last year found what it describes as staggering inequality in Scotland's schools. Pupils who live in the most deprived fifth of communities are just as likely to leave school with just one hire as students in the most prosperous fifth leave with 5. So does every child in Scotland have the same advantages as you had growing up?
Not yet. I think we've still got work to do, but more of those young people have greater advantages now than was the case 5 years ago. And let me be clear, I will be judged on this as I will be judged on everything in just a couple of weeks' time at the election. If you take the attainment gap in particular, and I know the qualification system is different in Scotland to other parts of the UK, so apologies if I'm about to use terminology that not everybody will understand, but at what we call level 5, which is our national fives, the attainment attainment gap has reduced by a third. At level 6, which is our hires, it has reduced by a fifth. There's work to do. We've expanded dramatically early years education, which everybody accepts is the biggest investment you can make in reducing the attainment gap later in a young person's school education. And we also have now, and this is something that's important to me as somebody who was the first person in my family to go to university, we now have record numbers of people from poorer, more deprived communities going into higher education. So we've made significant progress, but we've still got work to do. We would undoubtedly have made more progress had we not faced the disruption as everybody has faced over the past year with COVID. So there remains a lot of work to do. And one of the reasons I'm asking people to re-elect me as First Minister, the SNP as government, is so that we can get on with that job. We're probably the only party in this election that is putting a serious plan for government before the Scottish people.
You can't blame this all on the pandemic, though.
I didn't.
If you look at the...
I didn't.
But if you look at the statistics from before the pandemic, for example, the pass rate for higher exams has gone down over the last 4 years, 79% in 2015, 75% now. I mean, that's happening on your watch, isn't it?
Sorry, just to be clear, Sophie, I think people listening to me would not have heard me try to blame everything on COVID. Equally, I think most people understand that COVID has an impact on every aspect of our life. But if you look across the last 5 years at all of the statistics, what you see in Scotland is increasing attainment. So young people coming out of school with more qualifications and the attainment gap reducing, and more young people, particularly from deprived communities, going into university and indeed going on to positive destinations overall. I am not going to sit here and say that it is job done. I think there is more to do, nor am I going to apologise for setting big ambitions and saying to people, judge me on the record of my government overall. People will make a balanced judgment on whether they think the SNP has a good record in government, and the evidence suggests that people don't think we're perfect, but people think we're the party to be trusted with taking Scotland forward. And they'll look at the other parties as well. One of the interesting features of the Scottish election is that the other parties are all vying to be leader of the opposition. In these really serious times, Scotland deserves a party that is serious about government, serious about facing up to the challenges of government, leading us through the crisis and into recovery. And that's what I and the SNP offer.
OK, is the SNP a party that is serious about funding the NHS? Because this week you promised a transformational increase in NHS funding. The IFS says that actually the rise is less than the rise planned for England and is actually unlikely to keep up with demand. So is the rhetoric better than the reality here?
Can I come on to that in a moment? Because I want to take that on directly, and I think it's wrong. But, this is one area where I don't need to ask people to judge me on what I'm promising for the future. Judge me on the past. So at the last Scottish election, I made a commitment that we would increase funding in the National Health Service by £500 million in real terms. In reality, we've done 3 times that. The NHS budget over the past 5 years has increased by £1.8 billion in real terms. So, you don't have to look at my commitments.
What you're promising now, and you promised a transformational increase in NHS funding. The IFS say this works out as an annual rise of 2.1% above inflation. In England, it's 3.4%.
Can I come on to that point? But I actually think it is legitimate to say to people, look, you have pitched these questions at look at my record. So I'm pointing to the record where we actually exceeded the commitment we made. But on that point, the IFS have looked at the position. So there's 2 points to make here. The IFS have looked at the position in England up to 2023. That's the only the time frame in which the UK government have made a commitment in England. The commitment I've made for the next Parliament takes us up to 2026. So it's apples and pears to make the comparison that you have made. But the other point, and this is a key point, is that in a sense the commitment I have made is a backstop. Whatever the budgetary position that the UK government delivers for Scotland, we will deliver that transformational 20% increase in health funding. But if the UK government exceeds that and there is extra money comes through the Barnett formula, we will commit that to the NHS as well. So by definition, we cannot be spending less than the UK government does in England, because the commitment we've made is the backstop. And if the Barnett formula allows us to go further, we will go further. But, we We exceeded our commitment at the last election, and we will deliver this commitment at least over the next Parliament, a 20% increase in NHS funding, which amounts to £2.5 billion. Extra money for social care over and above that, which the IFS analysis also doesn't take into account, and also shifting the balance of investment so that much more is going into community health care and mental health care too.
OK, another area I'm keen to talk about as well is drugs. Scotland suffers more drug deaths per capita than any other European country, over 1,200 people dying of drug misuse last year. That's a record high for the 6th year in a row. How is that acceptable?
It's not, and I've been very candid about that. We have tried to tackle the drugs deaths, but we can't look at the figures for the numbers of people dying and conclude that what we have done has been enough or has been effective enough. So over the past few months, we've done a number of things to make a concerted attempt to turn this around. So firstly, I have appointed a dedicated minister with responsibility for this, reporting directly to me. We have set aside a budget over the next few years of £250 million to specifically support initiatives to tackle the drugs crisis and drugs deaths, and that is supporting more community work. It is supporting greater provision of rehabilitation beds, including residential rehabilitation and aftercare support, faster access to treatment so that if somebody comes forward looking for treatment, they get that quickly and aren't having to wait for that. So there is a whole package of policies and interventions now that we are taking forward to turn it around, because to be frank, it's not acceptable. And you can make choices as a politician. You can be confronted with something like that and try to dig your heels in and defend the indefensible, or you can do what I think is better and admit that this is an area where we have not done well enough and we're determined to do better in future.
You see, it sounds very good what you're promising. It sounds very candid. It sounds like you're very keen to point out what you want to change in the future. But people will be wondering, where has this been over the last 14 years that the SNP has been in power, when there's been a 160% rise in drug deaths and a 55% cut in real terms funding for alcohol and drug services? Is it too late?
Look, we didn't get it right. It's not because we didn't care. It's not because we weren't trying to do things, but we have concluded, because I don't think we can do anything else, that we haven't got it right. Now, I could sit here and I could try to set out some of the reasons why Scotland may have a higher number of drugs deaths than other countries, reasons that go back many decades in some respects to having higher drug use in the days when I was growing up, an older drug using population with multiple morbidities. I could say all of that, and some of that would be legitimate and be part of the explanation. But I'm choosing instead to say we haven't done well enough here. We haven't yet implemented the policies that have turned this around. So we're going to redouble our efforts. We're going to try different things. Now, I could also sit here and say that aspects of the levers over this are reserved. So the classification of drugs, whether or not we can have safe consumption rooms, which is something most experts in Scotland want to see. The levers of control of these things still lie with Westminster. We don't have all of the levers in our own hands. Now, I could say all of that, and all of that would have some legitimacy, but I'm actually choosing instead to take responsibility for not having done well enough and for setting out in great detail what we're going to do to put it right, I hope, in future.
I've been keen, in the interview to look back at your record in government, because it really matters, because you're effectively asking the Scottish people to trust you to lead an independent Scotland. So it really matters. You're clearly an exceptional communicator. You're clearly somebody who has strong approval ratings relative to other politicians. But if you look at the facts, record drug deaths after 14 years of an SNP government, still inequalities in education, although you admit that in some areas there's been improvement, there are still big inequalities when it comes to education. The highest rate of care home resident deaths from COVID in the UK. Why should people trust you to lead an independent Scotland?
Sorry, Sophie. The number of care home deaths in Scotland is far too high, and it shouldn't be a statistical competition. but I really do have to challenge that. The number of excess deaths in care homes in England has been much higher than in Scotland, or higher than in Scotland. In Scotland, we have recorded more of them as COVID deaths. So I will challenge that, but that is not saying that it is not the case that the number of COVID deaths in care homes, the number of COVID deaths overall, hasn't been too high, because it has been. Look, people will decide whether they trust me or not. That's what elections are all about. I'll put my record in front of the people of Scotland. I'll point to all of the things we have done over the past term of Parliament. We have established a new social security system in Scotland. We've established a Scottish child payment, which is lifting children out of poverty. The level of child poverty too high, but lower in Scotland than in any other part of the UK. We have made progress in closing the attainment gap. We've led the country through the COVID pandemic. I'll also be candid with people, because I think it's better to do that than the opposite, about where I think we haven't got things right, or where we have more work to do. And then people will make a judgment about who they trust most to lead the country through COVID, to get us into recovery. And we've put before the Scottish people a bold, ambitious, transformative programme for recovery from COVID. And then after COVID, when the time is right, to decide the future of Scotland, whether we should leave big decisions in the hands of politicians like Boris Johnson, or whether we should take those decisions into our own hands as an independent country, so that we can shape the long-term future of Scotland in the way we want it to be. And people will make their judgments about that. They'll look at me, my record, what I offer people, and they'll look at the opposition and the competition as well, and they'll cast their verdict on May the 6th. Okay. That's democracy, and I embrace it thoroughly.
Alex Salmond has launched a new party to help build a supermajority for Scottish independence. You must be very grateful for his help.
Look, he can speak for himself. We need a simple majority in the Scottish Parliament to give us the mandate for an independence referendum. And then, of course, we need a majority of the Scottish people to win independence. And, you know, when I listen to people who talk about supermajorities, they sound as if they think we can just bulldoze our way to independence, which is almost contemptuous towards those that we need to persuade.
Many people
across
Alex
Scotland
Salmond's been acting then?
I listened to the rhetoric around independence, and it seems to skip over the need to do the hard work of persuading those who voted no in 2014, many of whom are now open-minded. I know many of these people, but want to be persuaded and want to be treated with respect, and want us to make a convincing, persuasive case to them. And that's the hard work that I've been doing. Polling for independence is at a higher level now than it's ever been. But we've got to continue with that hard work, with that respectful discourse, and that's how we win independence. And, you know, I'm not particularly interested in an arm wrestling contest with other people about who supports independence the most. That's a conversation with ourselves. I'm interested in persuading those who are open-minded but need still to be persuaded, so that we build a majority for independence that then expresses itself in a legitimate process, because that's how we win independence, and that's what I want to do.
In the spirit of respectful discourse, if Alba does win seats at the election, would you work with Alex Salmond?
No, I'm not going to work with Alex Salmond. Firstly, I have concerns about his personal conduct that he hasn't acknowledged or apologised for. As I've just said, I don't agree with the approach to independence, because I think it is more, or it is risking putting people off rather than bringing people towards us. There's no shortcut to independence. We've got to do it through winning a majority and allowing that majority to express itself in a legitimate process. I also don't know what Alba stands for. For me, independence is not an end in itself. It's a means to a better Scotland, a fair, equal Scotland, where we value everybody who lives here for who they are. And I don't know what Alba stands for, but from what I've seen so far, I probably would have some concerns about that.
OK. Just finally, we talked a lot about lobbying on the programme this morning. The SNP Minister Fergus Ewing had a dinner with Lex Greensill and Sanjeev Gupta in 2017. This is according to the Sunday Mail. No officials were there, no notes were taken. If there's no record of what happened, how do we know it's above board?
Well, it was recorded in the usual way in the register of meetings. Look, I understand the temptation to draw an analogy between the scandal that we see developing around David Cameron, around the UK government, and the Scottish government's dealing with GFG. The two things are very different. We work directly with GFG to firstly save the DL Steelworks. In 2015, there was virtually nobody employed there. Today, it employs more than 100 people. And secondly, with that company to save the Lochaber aluminium smelter, and there's more than 100 jobs have been protected there, with more created as a result. The guarantee that was agreed to support that takeover of the smelter, the committee of the Scottish Parliament approved that. So it's not the lobbying scandal that we see elsewhere, and I think people should be careful in trying to draw that analogy. All the proper due diligence has been done. Things like the way in which Greensill has tried to use the NHS, which David Cameron allegedly lobbied for, that's not happened in Scotland, and we've not had some of the stuff around COVID loans. So I can see the temptation, but the two things are not the same.